started this afternoon, let me give you the quick overview of what I think we should do over the next 45, 50 minutes, how we want to spend our time together. We are talking about AccelaSMART rules validation analytics. That means we want to be able to look deeper into the revenue cycle. What are our billers and coders doing? What are the changes that they're making in AccelaSMART? And how can we make that process even faster and better than it is today? So I'm going to start with a little bit of background on where we're coming from on this. What are some of the frustration and pain points that we're hoping to solve with the AccelaSMART rules validation analytics, how that helps us be better users of AccelaSMART, and how that helps WhitePlume help you deliver better revenue cycle outcomes. So I'm going to start with that and give you some background information, and then I'm going to give you an overview of what we're trying to do and how that analytics package works. All right, and then I think it's helpful to kind of jump in and look at some of the 3 most common focus items that come out of those analytics. The first one is we're going to be looking at ignored rules messages. What opportunities and areas for improvement come out of that. And then we're going to look at the manual coding review, right? How can we be more efficient with our time? How can we leverage that exceptions only process? And when we look at each of these, we're going to look at what the data says. We're going to look at questions to ask, right? Because sometimes the analytics don't necessarily always give us the answer, but it helps us ask better questions. And then look at some of the potential solutions to those types of problems, and then see what impact that has to those practices. So we'll do that in each of our 3 examples when we look at ignored ruled messages, manual coding review, and high frequency changes. We'll show you how you can use the data to pinpoint opportunities to improve the revenue cycle process, opportunities for additional training to better leverage the software and get some customization that help you deliver better revenue cycle outcomes with a tool that you've already invested in. So we'll walk through those examples, and then I'll make sure that we leave plenty of time for questions and answers at the end. For those of you just joining us, welcome. Thanks for taking the time this afternoon. If you have questions as you go, feel free to put those in the questions panel. Shelly Wiggins will answer as many of those as she can, and then we'll share some of the ones that are most broadly applicable with the whole group as we get to the end of the webinar. So that's how we're going to spend our time today. I think that's the best and easiest way to lay it out for you. But let me do this. I'm going to start, we'll give everybody a quick warm-up poll question before we really dive into the content, just so you get an idea of how the polling works. This one's a pretty broad one, and so what you should see here is you'll see the poll pop up on your screen. Which of the following best describes your practice and your approach with your EHR and PM system? Are you likely to change that in the next 6 months? What about the next year or the next 24 months? Or obviously, answer number 4 is that you will not be changing EHR and or PM systems in the next 2 years. No, obviously, right or wrong answer here. It's just about your current thought process as we're kind of in this post-meaningful use era now. So take a look. Just to give you an idea, most people so far are in one of those last 2 categories, meaning unlikely to change in the next 2 years, or yes, we are likely to change in the next 2 years, but don't have as many in the next 6 months or the next 12 months. So I give everybody about another 10, 15 seconds to kind of lock in your answer. Just select it, and then in the bottom right-hand corner of that box, you can hit submit, and that'll be that. All right, 5, 4, 3, 2, 1. All right, thanks everybody for participating. Very helpful. Just to share with you what your peers are saying. Over 90% of the people on the webinar this afternoon are saying that they are not likely to change in the next 12 months. The majority of those, it's about 2 to 1. They're saying they're not going to change in the next 2 years. So that goes along with what you hear in the market. There are a lot of people that are burned out with a lot of technology changes. Meaningful use was a burden on everyone, so was ICD-10. And most people are saying, I'm going to invest in my current system rather than trying to rip and replace that with a new product. So thanks again for taking the time on the polling question. I hope that's valuable information for you. So let me jump in and give you a little bit of background information on some of the problems that we're trying to solve, some of the frustrations that we hear when we talk to people about the revenue cycle process, particularly from an administrator, practice manager, revenue cycle director perspective. A lot of people are frustrated with the revenue cycle process. They know they have great billers, they know they have great coders, but they don't have a lot of visibility into what they're doing on a day in, day out basis. They know that it's complex. They know that it's critically important to the cash flow of their practice, but they don't have a lot of visibility. They can't get their hands around that process. And that means that it's really difficult to benchmark. How are we doing compared to our peers? Maybe we look at traditional metrics like denial rate or accounts receivable days, but really looking at the work product of billers and coders, that can be a difficult thing for them to do. So what we try to do is give you a bit more visibility and data into that process so that you can understand what the people are doing, what the process looks like, and so that you can make sure you institutionalize that so that you don't have a lot of turnover risk, right? And when I say turnover risk, the frustration point that I hear is I've got great billers and coders. They really know their stuff, and they do a great job of getting our claims paid completely and correctly the first time, and they do a great job of leveraging AccelaSMART to do that. But I'm worried that if I ever lost that person, if she ever won the lottery, if she ever decided that she wanted to retire, we would have a lot of that head knowledge that might walk out the door with those people. And that's what we want to make sure that we insure against. We want to make sure we have a bulletproof backup plan. So that's some of the frustration that we hear. And AccelaSMART is designed to help your practice with those, right? The two things that most people are looking for with AccelaSMART are revenue cycle speed and revenue cycle accuracy, right? And through the analytics, we're able to benchmark that and see what that can do for most practices. White Plume clients are on average 4 times more productive than practices that don't have White Plume. One of the metrics that we look at, for those of you familiar with our analytics, is we look at encounters per hour. And the average practice without White Plume can process 25 encounters per hour per person. So per biller, per coder, per FTE, they can process 25 encounters per hour. The White Plume client average is 107 per hour. That is a tremendous improvement from a speed perspective. And while they're doing that, they're making changes on 52% of the encounters. So they're doing a lot of cleanup work in a post-encounter coding environment. They're not turning their doctors into coders. They're able to make that change very, very quickly. And those are great results. Super users are even faster. We define super users as the top biller, top coder from a speed standpoint at each of our client sites. And those super users are up to 170 encounters per hour. That is a fantastic improvement over the kind of industry average of 25 to 30 encounters per hour. And one of the ways you're able to do that is by leveraging what we call exception-based workflow. I don't have to stop and look at every single encounter in AccelaSMART, because one of the things AccelaSMART is trying to do is let me manage that on an exception-only basis. That's how you can get that type of speed and still have outstanding accuracy, where we have very, very low denial rates. We're making sure that we have process in place to capture every single mischarge, whether that's a supply code or a vaccine or an x-ray or DME supply codes. We want to make sure we capture every single one of those and leverage the intelligence within AccelaSMART to do that. And the last piece of that is making sure you have a bulletproof backup plan. How do I build the intelligence into AccelaSMART so that when we have to grow our staff or we have turnover in our staff, we can still deliver the outstanding revenue cycle outcomes that our practice depends on. And so in order to do that, it's always a combination of people and process and technology, right? It's not just a pure technology solution, right? Without good users, AccelaSMART is not nearly as valuable, right? And great coders cannot be nearly as productive without a tool like AccelaSMART. But we have to make sure we pay attention to our process as well. And that's one of the things that analytics really allows us to do. It allows us to drill into the details of what the people are doing with that technology tool, what that process looks like, and see some of the best practices within your own practice and across the WhitePlume family so that we can share some of those with you, right? So if you've got a user or you've got a coder who is at 60 encounters per hour and the rest of the practice is at 120 encounters per hour, right? How can we ask some questions to understand what best practices could be shared to help improve the performance of that user? That's what we want to be able to do with the analytics. It'll help us ask better questions and help use an automated tool to identify where there may be opportunities to improve. Right? That's what we're trying to do with the analytics. Very, very difficult to just strictly look at the data and be able to know exactly the answer, but it helps us ask better questions and make those workflow changes, make recommendations, make changes to the software, make changes to the process, offer retraining opportunities that can really be pinpoint targeted to your practice about where there are places to improve the revenue cycle outcomes. So that's the overarching thing that we're trying to do with this analytics tool. It's not just about the data, it's putting the people and the process and technology together in order to make that work, right? So let me jump in and we're going to start to look at what that workflow looks like. I'll give you a quick refresher on that, and we'll jump into a couple of these examples. Just a reminder, if you do have questions, if there's something that I said that doesn't make sense and you want to use the questions panel, Shelly can help clarify that for you as we go. So here's what the workflow looks like for a typical practice in AccelaSMART. There's always the charge capture layer that we're talking about. Some of you may use all of these applications. Some of you may only use one, but let me talk through each of them briefly for you, just so you'll understand what the visual is. AccelaPath is our inbound interface from third-party kind of charge capture tools. So if you are capturing charge data through your EHR or through a lab system or through a radiology system, that may be coming to WhitePlume through an HL7 interface that pulls the data, from AccelaPath into AccelaSMART. Others of you may be using AccelaCapture. AccelaCapture is our customized electronic superbill that we can build down to the physician-specific level that allows you to quickly and conveniently capture all of those charges. Some people use that alongside their EHR. Some people use it as a supplemental tool to their EHR. Other people use it completely standalone. We do still have some practices that don't have an EHR, and they use AccelaCapture to capture that data electronically. And then on the far right is AccelaMobile. AccelaMobile is a web-based mobile charge capture solution that can be used on any type of device with a web browser. So PC, Mac, iPhone, Android, typically designed for physician charge capture when they are away from the office. So hospital charges, sometimes surgery center, sometimes nursing home, those types of care settings where they can capture that data quickly and then automatically transmit that to their billing team in real time to be able to pull those charges into AccelaSMART. So any combination of those three is typically how charge data is arriving at AccelaSMART. And then when we get into AccelaSMART, that's where the billing and coding workflow really picks up. AccelaSMART is going to look at all of the core rules, all of the custom rules, all of the smart filters, and what it's doing is looking at CCI edits, medical necessity guidelines, LCDs, NCDs, rules that are built in that are payer, provider, location specific, filtering out things that don't need to fire, and trying to sort all of those encounters into one of two buckets. The first one is encounters that need review, and the second one are encounters that are clean. So if an encounter or a group of encounters comes in and the coding was relatively straightforward, there weren't any mismodifiers or bundling problems or medical necessity problems, it's going to flow into that right-hand side for clean encounters. If there is a problem, something that needs to be reviewed, like something's out of our VU order, or a particular payer doesn't allow these two CPT codes to be billed together, or that payer wants a different modifier than what we tried to use, you need to stop me and have me look at that. That'll fit on the left-hand side of this workflow where those encounters need to be reviewed, right? So that's the typical workflow that we look at. That's what AccelaSMART is trying to do, is to sort those into those two buckets. And the practices that do that really, really well typically have better revenue cycle outcomes than the ones who don't. So we're going to talk today about how to figure out where those opportunities for your practice might be, how you might be able to leverage that a little bit better. So let me go ahead and pull up our second polling question for you. So you should see that popping up your screen shortly. And the real question is about how your billers and coders are using AccelaSMART today. Do your billers and coders review all of the encounters in AccelaSMART, or are you using AccelaSMART to separate those out into the two categories that we just discussed? So the question is, do your coders and billers review all encounters? Yes, we do review all of them. No, we use AccelaSMART to filter those out. So I'll give you maybe another 15, 20 seconds to answer that question, and then I'll close the poll. All right, 5 more seconds. All right, thanks everybody. It was about, just FYI, it's about a 50-50 split there. A few more that are reviewing all encounters than using that to filter those out. So we're going to talk about that as one of our examples today. But let me go ahead and move on and drill down into that AccelaSMART workflow in particular. The first example that we're going to look at is on the left-hand side when we're looking at the encounters that require review. So these are encounters that have a validation message. They have a rule message, something fired that we need a biller or a coder to look at. And what we're doing with the analytics is trying to view on a user-specific or doctor-specific basis what's happening on those encounters. And there are really two outcomes. For those types of encounters that require review, they were either we made a change to that encounter, right? That's what we would expect to happen the majority of the time, that when there's a validation message, that we are making a change to correct that problem. We're making a change to resolve the validation message. We're adding a modifier. We're changing the way something was linked. But what we also see is sometimes there are encounters where validation messages are firing and there's no change. We're not making any change to that encounter. And So that's an important thing to look at and understand, get underneath it. What's happening? Why is that happening? Are we making a good decision to not make a change, or is that a problem? So we want to be able to drill down into the details, and that's what rules validation analytics allows us to do, is to see that at the high level from an aggregate perspective, and then drill down into the detail to be able to understand the answer to some of those questions, because that's what we want to be able to ask. So let me walk through kind of the way that we view that with you to see if this is a helpful way to look at it. So when I'm looking at ignored rules messages, right? So a validation message is firing. I should be seeing that if within the AccelaSMART workflow. I really want to stop and ask a couple of questions. And the first one is, can I see what rules are being ignored? Is there any trend in the data? Right? Is it the same one every time? Is it happening the same way across all of my users? Right? Which user is ignoring it the most? Because they may be able to help me get underneath the data and answer some of these questions, right? And what I'm really after is, okay, I understand which rules are my top offenders, which ones are showing up at the top of this list, but now I want to understand why. Because if I don't understand the context of what's going on, it's really hard for me to make an improvement, right? I don't know which improvement to make. But usually, once we start working through this with a client, and we will help you work through this. You can talk to your CAE about it. That's your account executive. We can get some of our implementation specialists and trainers on the phone to walk through this with you and your team. But what we usually see and what we usually end up recommending is one of a couple of different solutions. So one thing that we like to talk about is what we call custom rule hygiene. And that is simply, we build custom rules. We help clients build custom rules in AccelaSMART. That's where a lot of the power of AccelaSMART comes from. But if we don't continue to update and clean and maintain those rules, sometimes they get a little bit stale. I may have a validation message that's firing when it really shouldn't, or something that was applicable 2 years ago that really is not something that I need to worry about anymore. And so keeping those up to date is really, really important. If you need help with that, that's something that WhitePlume can help with, on a monthly or quarterly or annual basis. We've got some flexibility there in how we do that and how we work with other clients. But that usually ends up being one of the recommendations that comes out of this, is looking at that custom rule hygiene. What is the process for keeping those updated? Another thing that we often recommend is smart filters. So what smart filters are doing, it says, I've got a validation message, and it's a good rule, right? Whether that's a core rule or a custom rule, it's a good rule, but it's not always applicable, right? Say I've got a practice that has clinics across state lines, and I want to filter that rule out so it doesn't fire for my location codes that are in the state to the west, right? I need to filter those out for those locations. Or I need to filter that out for Blue Cross Blue Shield and Humana, because they don't follow the same standard that all of my other payers do. Or maybe I need to filter it out for a particular provider or a particular set of providers. Smart filters are a very powerful tool. And what we're trying to do there is make sure you only get validation messages on the encounters that you need to look at. Because if you've got rules or messages that need to be filtered, that will move that over into the other bucket of clean encounters, and being able to leverage that type of workflow will increase your encounters per hour metric. Our top performing clients are really, really good at custom rule hygiene and smart filters, and there's no reason that your practice can't do the same. And we're happy to help you with that if you need help. And the last thing that comes out of this is sometimes there's a need for AccelaSMART user training. They don't need they received it go live. Sometimes you might, but most people, they need a little refresher course, and they want to use the analytics to target the learning areas for each user that will have the biggest impact for the practice, right? There's a lot of opportunities for leverage here. We can look at the data, know what it is for your practice, for your users, to know where that training can have the biggest impact, right? We can know exactly what we need to focus on, and that way we can spend a limited amount of time in the training that can be very, very cost effective. So you get not just a 2x return, but you can get a 10x return on that type of investment for your users, and leverage that across the entire practice. So when we look at the data and we're able to ask better questions, these are typically the recommendations that come out of that. And what we typically see as a result is increased revenue cycle productivity. If there are filters that need to be applied, if there are custom rule hygiene that needs to be done, or user training, all of that is focused on making your coding staff and making your billing staff more productive. Can we move them from 80 to 100 encounters per hour? Can we move them from 100 to 130 encounters per hour? If we apply these types of changes in the right way, the answer is absolutely yes. The second thing we'll see is reduced denied claims. Maybe there are things that are not being changed that need to be changed. We might have some things that are slipping through the cracks here that can be remediated with a better custom rule or a little bit of end user training. That's what we're trying to do with this rules validation analytics. The last piece is being able to capture missed revenue. That happens from time to time when there are things that are not on the encounter that really should be. They might be slipping through the cracks, the things that we're not changing that we should be, or maybe we see a little bit of variation in the way that user A handles it compared to user B, and we want to be able to build that into the process. Remember, it's a combination of people and process and technology. We want to be able to leverage all three of those areas to get your practice the best return and the best outcome out of AccelaSMART. So that's the first example. What we're talking about is ignored rules messages, and that's really focusing on the encounters that require a review. So let me flip over, and we're going to look at the other side of the equation here for just a minute. On example number 2, we're looking at manual encounter review. A lot of our clients, from our polling data, maybe close to 50% of those of you that are on the phone today may have a significant opportunity on this kind of half of the AccelaSMART equation. When we have clean encounters, that means those are encounters that are they don't have any validation messages on it. They have passed all of the rules, and what we see is we expect there to be no change on those encounters, right? Because we think that they're clean. We don't think that they need any sort of change to that encounter. But what we often see is many times we still have users that are changing that encounter. And based upon the poll results of what we saw today, this is probably familiar to many of you. It's a difficult part of the process for people to let go of sometimes. Most people in the revenue cycle 1.0 world, what they would do is they would spend lots and lots of time making sure that every encounter was pristine before it went out the door. And that was a lot of times what the organization was asking them to do. But what we see as we're entering this revenue cycle 2.0 world is more and more organizations are focusing on the amount of time that they spend on those encounters. And they're looking for ways to be more efficient. And that's a slow mindset shift for many practices. Because you know what? I need to be able to leverage my tools, right? I need to be able to leverage that so that we can take our excellent coding and billing staff and make sure that they're operating at the top of their capabilities. So what I want to do is look at what changes we are making to those clean encounters, right? Where's that manual encounter review happening? So we're going to drill down and look at that, kind of spotlight that portion of the workflow. So when we have manual encounter review, what that means is there was no validation message, but the AccelaSMART user is making a change to that encounter anyway. When we compare the pre-encounter to the post-encounter, they're making changes to that. And again, the analytics aren't going to tell us all the answers, but it does help us ask better questions. And the first thing I want to ask is, what changes are being made? Right? What are we changing? What are we changing most frequently? Maybe I want to look at the top 3 changes that are being made in that manual encounter review bucket. Maybe I want to know who's making those changes, right? And I eventually want to be able to ask, why are we making those changes? Maybe it's because we always have done it that way, right? Maybe it's because I know in my head that when Dr. Smith sees a patient with this particular diagnosis, he almost always orders this test. And I need to make sure that we bill for that, right? You probably have a good reason as to why you're making those changes. For some of you, maybe not. Maybe it's just we've always done it that way. But I would bet the majority of you have a good reason for why you're making those changes. I'm not trying to question why those changes are being made. I just want to make sure that we understand. Because once we understand and are able to answer those questions, we can help automate and improve this part of the workflow. The data helps us drill down and helps us ask those better questions. And so when our team works with clients and their billing staff and starts to ask these questions, we typically end up making one of the following recommendations. Back to custom rule hygiene, this time on the other side, saying there's something that you're looking for. There's something that you know in your head that's not being caught with the rule in AccelaSMART. What is it? Let's talk about that. Tell me what you're looking for. If you can tell us what you're looking for, if we can work together on that, we can help you build a custom rule that will catch that going forward. Right? If you think about all the changes that have happened for a physician's practice and how hard that part of the process is now, we want to be able to help you make that easier. We want to be able to help you do your job better so that the rule can do the hard work. The rule's going to look for that scenario every single time, all day long, every encounter, and only bring it to your attention when you need to spend time on it, right? Rather than you having to look for that on every single encounter. So custom rule hygiene can be a great tool to deploy there. Maybe there are some updated policies and procedures that you need to look at, right? Sometimes there are things that are outdated that you start to find out, wait a minute, I can see in the data that Jenny makes this change every single time, right? She makes it on 800 encounters a month, but nobody else does that. And you know what we typically find out? It's that nobody told Jenny we don't have to do that anymore. Jenny is smart. Jenny is efficient. Jenny, in this situation, is incredibly thorough, right? You told her that one time, and she's done it every single time, every single day since then. But if we forgot to go back and tell her we don't have to do that anymore, she's wasting time because we don't have an updated policy and procedure. And that goes back to leveraging the tool to keep up with that so that we're consistent across our revenue cycle team. And then the last part that typically comes into play there is maybe some training. For those of you who might be thinking, yep, we do look at every single one of those, and I don't want my people to have to do that anymore, then this may require some training, right? You've got the tool that enables you to do it, right? You've got the people who are very good, but we need to change our process a little bit, right? We may need a little bit of help with that. Our training team is very good at helping groups work through that part of the process. So I bring that up to your attention as something to think about as well. Because what this means for our groups that are able to start to make these types of improvements is their revenue cycle is much more productive. The number one thing that you can do to make your revenue cycle staff more productive is be able to handle the validation messages on an exception-only basis, right? And if you're not doing that today, I consider that to be good news for you, because you've got opportunity in front of you, and we can help you get that. It also gives us a bulletproof backup plan. It allows us to build in and leverage the tool for what it was designed to do, so that no matter who's on vacation or who's out sick or who is new to the team, they are operating at a very, very high level of performance. All right, let me pause for just a second. I'm going to launch our third polling question. And this one's similar to the last one that we asked, but this one is not looking at what your current process is today, but it's looking a little bit about what your future process might look like. So would you be willing? Would you be open to the idea of only reviewing encounters with validation messages? So for those of you who are already doing this, obviously you are open to that. But for those of you who aren't, would you be interested in at least thinking about, if we got our custom rules, if we got our smart filters working the right way, would you be willing to do that? Again, we're happy to help with that. We think that's a great thing that you can do for your process. So I'll leave that open for a little bit longer. Got two choices, yes or no. Again, no right or wrong answers, just a time for you to think a little bit about your workflow and what you'd like that to look like in the future, maybe over the next 6 months. All right, about 10 more seconds. If you haven't answered the polling question, please go ahead and lock that answer in. All righty. Well, maybe I made that question too easy. This is the one of the few times I've ever seen our polling question where everybody's answering the same way. But the answer is yes. Everybody that answered the polling question is saying, yes, we do want to consider that. I know there are always caveats to that, but something to think about, certainly a takeaway for you, maybe to look at that part of your process and let us help you think through what would need to be done to gain that type of productivity. All right, so we've looked at kind of one half of the equation, right, where we were considering the encounters that needed to be reviewed, where we weren't making changes, right? We talked about maybe the need for rules hygiene or smart filters. We looked at the half of the equation where we were talking about the clean encounters where you were making changes, right? Looking at those manual encounter review process and thinking about how do we build new custom rules? How do we operationalize all of that data that may be in your billers or coders' heads? But the third example, the last one that we'll talk about today, before I open it up for Q&A, are high-frequency changes. So for some groups, this can be some low-hanging fruit. Typically, it's on the left-hand side of the process where you have encounters that need review. So these are encounters that have validation messages already. We're finding something that's wrong. Maybe it's something as simple as, anytime I have this series of lab charges, they always require a venipuncture, right? Because we can't get the blood any other way. Or maybe it's an example that says, when I have a patient that comes in with these, we have these multiple CPT codes and they come in the wrong order, I need to reorder them into the correct RVU order, right? Or maybe it is when I've got a bilateral procedure and it's this particular payer. I want to have it on one line item with a 50 modifier instead of 2 line items with an LT-RT modifier. Whatever that may be for you, it's happening over and over and over again. That's what I call high frequency changes. So they typically have rules that are built in AccelaSMART, and they're typically changes that your users are making. Now, the analytics will help us look and drill into the details of what those high frequency changes may be for your practice, right? But that's the ballpark of what we're talking in. And so when we start to look at those, right, when we look at high frequency changes, the questions that we want to ask, again, what changes are being made most often? Are there any patterns that we can identify? Is it user specific or doctor specific or payer specific, right? What does the data tell us about that? And then that allows us to really drill down and understand which of those changes can be automated. When I talk about automation, what I'm looking for are ones that really don't require a decision. When I see A, I always need to add B. When I see X, I always need to change it to Y. Those are the type of high frequency changes that are often automation candidates. When you start to get into and your coders and billers know this, when you start to get into well, it depends, or, ooh, yes, but I need to look at the documentation, those are usually not good candidates for automation, right? So you have to be selective with what you automate. But if we can find some of those high frequency changes that are being made very, very often in your practice that are good candidates for automation, those are the ones that can really help streamline the process. If we can identify those and understand what they are, we can typically look to automate those in several places in the workflow. If you're an AccelaPath client, it's one that maybe it's an update that needs to be made in the template, right? We can look at the data in AccelaSMART and rules validation analytics to help us know where we need to go back to the front end of the process to make changes in the EHR template. Now, if that type of change is going to slow down your doctors or turn your doctors into coders, we don't want to do it, right? It usually is not a great strategy to save coder time at the expense of physician time, right? I know that, I don't mean to sound flippant when I say that, but the reason we're here is to try to help your doctors get paid for what they do and let them do what they love, which is taking care of patients, not coding. Most of them don't love coding, right? But many times we'll recommend a quick change or an update to the EHR template. For those of you that are Accela Capture clients, there may be something that's in the form design, right, on that electronic super bill that needs to be updated or tweaked or changed. A lot of that can be automated, and we can take these analytics and use that with your forms specialist to make those types of updates. And a lot of that is able to happen behind the scenes, right? So that the physician doesn't have to change his or her workflow, right? So the clinical staff can keep doing exactly what they're doing, but we can fix the coding change for them automatically. Another place that we look for opportunities there on those high frequency changes, once we understand which ones are good candidates and why they're happening, is through scripting, right? Where we can make that an automatic process that happens before the charges are posted to your practice management system. And we can do that without having to spend any coder or biller time in AccelaSMART. When we can find these types of opportunities for you, again, increase revenue cycle productivity. That's how we can get you up to 107 encounters per hour. If you're already there, it's how we can get you maybe to 173 encounters per hour, up to that super user speed, right? Very, very small investment of time and dollars to be able to get a lot of productivity gain. That's what we're looking for. Leverage opportunities. Where can we really help our clients get the outcome that they want? And it also reduces the variability in your revenue cycle. Any place where we're able to automate changes like this, if they're good automation candidates, right, it makes a simpler, more elegant solution, right? There are fewer points of failure, and that gives you long-term sustainability in your revenue cycle. That's what we want to help our clients do, because what we've seen is when we're able to look at this data, work side by side, hand in hand with our clients, they're able to get the type of revenue cycle outcomes that their management team, that their physicians, that their board are looking for, right? And it frees up their time to do some of the other things in the coding process that need to be done, that sometimes slip through the cracks. So we're looking for opportunities like that. And what we've found is rules validation analytics helps us to get there. Okay, let me launch our last polling question. I told you there were 4, and there are. So when we're thinking about these types of validation analytics, what do you think? How frequently would you want to kind of look at this data, review it, to try to make adjustments to your process or to try to make improvements? Is that something you'd want to do on a monthly basis? Is it something you'd want to do on a quarterly basis? I always get confused with this. Semi-annually means twice a year. So if you'd like to do that maybe twice a year, every 6 months, semi-annually would be the choice. Never, if you say, hey, you know what, I've thought about this, I don't think that's something that we can do, or we may not have much opportunity for improvement, never would be the choice for you there as well. So I'll give you about 10 more seconds to answer the polling question, and go ahead and get those locked in. So far, there seems to be pretty high consensus on quarterly. That's what the kind of the early results are. All right. Thanks, guys. Appreciate the feedback on that and the participation. That always makes it fun. So let me do a quick review of what we talked about today. We're looking at those AccelaSMART validation analytics. What we're trying to do is use that as an opportunity to find places where you can make your revenue cycle faster, where you can make it more accurate and more automated in a bulletproof backup plan. What the analytics allows us to do is ask better questions and to look at areas where we can put some targeted focus and make some time investment to make your process better. The 3 areas that we looked at that happen most frequently with what we've done so far with this on clients are: number 1, ignored rules messages. Those are encounters that need to be reviewed, but you don't end up making a change. We need to think about filtering those. We need to think about rules hygiene. We need to think about training. Area number 2 was manual encounter review. Those are encounters that are not flagged for review in AccelaSMART, either by habit or by policy. Billers and coders are reviewing every single encounter, and some of those they're making changes on. If we can understand what those are and why, we can typically leverage end user training, policy changes, and rules hygiene to allow them to work on an exception-only basis, and that allows them to be much more productive. And then the third part is looking for opportunities for automation on high-frequency changes, asking what changes we're making most frequently, which ones of those are good automation candidates, so that we can reorganize that process, that technology, to be more effective for your team. So I hope that this was a helpful session. We are finished a little bit early, so we've got some time for questions and answers. If you've got any questions that you haven't submitted, please go ahead and put those into the questions panel, and Shelley will monitor those for us and kind of help walk